Major blood vessels. Special circulatory routes, skeletal muscle. Highly variable flow. At rest, arterioles constrict, total flow about 1 liter per minute. During exercise, arterioles dilate in response to epinephrine and sympathetic nerves. Precapillary sphincters dilate due to lactic acid, CO2. Blood flow can increase 100-fold. Muscular contraction impedes flow. Isometric contraction causes fatigue faster than isotonic. Special circulatory routes, lungs. Low pulmonary blood pressure. Flow slower, more time for gas exchange. Capillary fluid absorption. Oncotic pressure overrides hydrostatic pressure. Unique response to hypoxia. Pulmonary arteries constrict, redirects flow to better ventilated region. Pulmonary circulation. Pulmonary trunk to pulmonary arteries to each lung. Lobar branches for each lobe, 3 right, 2 left. Pulmonary veins return to left atrium. Increased O2 and reduced CO2 levels, pulmonary capillaries near alveoli. Basket-like capillary beds surround the alveoli. Exchange of gases there at alveoli. Major systemic arteries. Supplies oxygen and nutrients to all organs. Arterial pressure points. Some major arteries close to surface, allows palpation for pulse and serve as pressure points to reduce arterial bleeding. Major branches of the aorta. Ascending aorta. Right and left coronary arteries supply heart. Aortic arch. Brachiocephalic. Right common carotid supplying right side of head. Right subclavian supplying right shoulder and upper limb. Left common carotid supplying left side of head. Left subclavian supplying shoulder and upper limb. Descending aorta is thoracic aorta above diaphragm and abdominal aorta below diaphragm. Major branches of the aorta. Arteries of the head and neck. Common carotid divides into internal and external carotids. External carotid supplies most external head structures. Arterial supply of the brain. Paired vertebrae A. Combine to form the basilar artery on the pons. Circle of Willis and base of brain is formed from anastomosis of basilar and paired internal carotid AA. Supplies brain, internal and orbital structures. Anterior, middle and posterior cerebral. Superior, anterior and posterior cerebellar. Arteries of the upper limb. Subclavian passes between clavicle and first rib. Vessel changes names as passes to different regions. Subclavian to axillary to brachial to radial and ulnar. Brachial used for BP and radial artery for pulse. Arteries of the thorax. Thoracic aorta supplies viscera and body wall. Bronchial, esophageal and mediastinal branches. Posterior intercostal and phrenic arteries. Internal thoracic, anterior intercostal and pericardiophrenic arise from subclavian artery. Major branches of abdominal aorta. GI. Kidney. Lower limb. Celiac trunk branches. Branches of celiac trunk supply upper abdominal viscera, stomach, spleen, liver and pancreas. Mesenteric arteries. Arteries of the lower limb. Branches to the lower limb arise from the external iliac branch of the common iliac artery. Major systemic veins. Deep veins run parallel to arteries while superficial veins have many anastomoses. Deep veins of head and neck. Large, thin-walled dural sinuses form in between layers of dura mater, drain brain to internal jugular vein. Superficial veins of head and neck. Branches of internal and external jugular veins drain the external structures of the head. Upper limb is drained by subclavian vein. Superficial and deep veins of upper limb. inferior vena cava and branches. Liver, kidney, lower limb. Notice absence of veins draining the viscera, stomach, spleen, pancreas and intestines. Veins of hepatic portal system. Drains blood from viscera, stomach, spleen and intestines, to liver so that nutrients are absorbed.